All right, this is Smooth 98.1. This is your love music, love live station. 32 minutes past 6 a.m. on a feel good Friday morning. It is 25th day of April 2025, 5 days till the end of the month. But what is important is we are at the final working day in the week, and I can't be any more excited because the weekend is finally upon us. But before that, there's a lot of things that we need to get through. Let's get through the work day, first of all, which is just kicking off. And yours truly, Ayokunmi is here to walk you through it. This is the world of business on Business Express, brought to you by IntoSwitch. It's a Friday, and on Fridays, we talk about tech related matters. And today isn't going to be any different, but it'll be tech with a little bit of a twist. It's tech mixed with healthcare. Yes, you didn't think those two could mix, right? Well, that's why we are here to bring it all to your attention. We're talking about improving Nigeria's healthcare and logistics with tech. Of course, tech can be used in all sorts of sectors and areas, and healthcare is definitely one of them. And being able to integrate tech into healthcare makes things a whole a lot easier. But it's not about me giving you the information because I mean, who am I to do so? I have a special guest joining me on the show this morning in the person of Benedicta Etafo. She is a data analyst and she's going to be giving us all that knowledge and information. Good morning to you, Benedicta. Great to have you on the show this morning.
Good morning, and thanks for having me today.
Absolute pleasure. Thank you for being here to share your knowledge on this particular matter when it comes to healthcare. And we're going to start with that right off the bat. And I just want to know how exactly can technology help to improve record keeping? Because when hospitals are concerned, oh, this file, that file, oh, we didn't find your file, this one, and all those, funny things. How can tech solve all those problems when it comes to record keeping?
I'm so happy to have this question today because I think weeks back, myself and my friend were speaking about the healthcare system in Nigeria and saying that it's not totally bad, to be fair, just that we need like a little bit of tweaks here and there, which is where record keeping comes into play. So technology can improve the way we keep our records in Nigeria in terms of us now moving from paper-based systems, which are vulnerable to losses, tampering, or inefficiency, and even security breach. We can then move from these paper-based systems to
Okay.
electronic health records, whereby healthcare providers can better manage data in terms of making this patient's information, easily accessible to the patients as well as to the service providers. This then will now help in terms of making like better diagnosis as well
Okay.
as continuity of care and better data driven decisions. It will also help us to like simplify audit trays as well as billing and regulatory compliance. So, in my own opinion, I would say it's best for Nigeria to adopt cloud-based systems which are
Mm.
easily user friendly so that these patients can access their information, and then each and every hospitals and clinic in Nigeria can sync their data to the central systems for better optimization.
Hmm. Okay, interesting thoughts. You've kind of, should I say, opened up the door to where I was going to. Before I go there, for you out there listening to us, you can join the show this morning, join the conversation. Any comments you might have, any experiences at a hospital where, they've adopted some form of tech or another for their record keeping and so on and so forth. I know that some government hospitals have already decided to move or are moving away from the paper-based record keeping and so on and so forth. Let us get your thoughts and experiences. Send them to us on WhatsApp on 0809 444 0981. Okay, let me walk into that door that you opened up, Benedicta. Talking about, different healthcare players, they have their own software, talking about your Clinic Plus, your
Yeah,
MediTrack, and so on and so forth. Now, in
yeah.
your opinion, should there be one universal database, or are we okay as long as most are digital? Which is the better way to go?
So, with my years of experience working in the UK and seeing how one universal database actually helps the system, I would say
Okay.
yes. right? Not necessarily that each hospital or each clinic should have the same electronic patient record system, but they should have like the umbrella that those different systems feeds back to. So for the UK, they have the NHS app, right? And the moment you register with the NHS, you have a unique NHS number, which is unique to you. So regardless of you moving from one city to another, that number doesn't change. Your record doesn't change. All you need to do is just to register with your local GP in your new area, and then your information is electronically transferred from your previous GP to now your
To the new
present,
one.
yes, to the new one.
Okay.
So this now helps to reduce duplication. So instead of you having all your information in hospital A, all your information again in hospital B, right? It will now then help to just have all your information in one central database. So
Database.
exactly. So this can then make the healthcare providers to better manage your medical conditions because they already have all your information from the beginning to the end, so they can better manage it. It can also now help the public health analytics to better make their analysis and for it to be consistent and for it to be valid, right? So in my opinion, I would say not necessarily that they should have the same electronic patient record, but all these different electronic records should feed into one universal database.
And that makes a whole lot of sense, regardless of whatever software that is being used. Let it go to
Yes.
one. I mean, I can just imagine the ease.
Yes.
You live in Lagos. You move to maybe Kaduna for something. You need to go to the hospital, and the doctor there can actually access your medical
Assess it.
history
Yeah.
right off the bat. Now that would make life a whole lot easier. But we
Yeah.
also need to talk about one of the big elephants in the room, and that is training for healthcare staff. Is there enough of that for them on how to utilize these digital tools for making their jobs easier?
No, at the moment,
Ah,
no, I don't think so because I have friends who are doctors and nurses, and like from their curriculum, they're usually being taught the clinical aspect of their career, right? One would think that since the world is now moving into the technological age, right? These digital tools should be infused into their curriculum so that while they are practicing, while they are learning the clinical aspect, they can also learn the digital aspect as well. And it doesn't just stop there. When one is being employed in a particular organization, there are some boxes that they should tick before you would say they are fit to attend to any patient, regardless of the clinical background that they
okay.
would have, right? So they should go through the whole onboarding stage, the whole shadowing stage, whereby they shadow persons who have been in that job for quite some time and they know how to use these digital tools. Let's not forget that some clinics would have ranging of different staff, that is staffs who may be Gen Z or staff who may be millennial, and it's the learning curve for the different generation is very different, right? Some might be
Right.
willing to adopt these new digital tools, or some might find it like very difficult to adopt them, which is why in the UK you have courses that everyone takes, right? You take this course and then they would say, okay, this certificate for this course expires probably in 1 year or in 3 years. So this is a form for you to refresh your memory. So by the time it expires, you have to go back and take that course again to refresh your memory. So it's not just about them learning it in school or learning it at work. It's the continuity, it's the business continuity at the end of the day.
Right, interesting stuff. And just to add to that, those refresher courses also for them to get on board any new information that might have
Yeah.
come up, updates and so on and so forth.
Yes.
So that
Yeah.
makes a whole lot of sense. Okay, let's jump into the world of logistics really quickly here before
Yeah.
time actually flies by. You know how that happens. Um,
Okay.
I mean, from your perspective, Benedicta, do you think motorbikes are the true representation of logistics in Nigeria?
Ah, Okadas. I would say yes and no, to be fair.
Okay.
So Okadas, or rather motorbikes, I mean, they have their advantages, mostly like in congested cities, like let's say Lagos, right? You are able to
Mm,
get your item as fast as possible regardless of traffic, right? But these advantages also have huge disadvantages, right? Because motorbikes are unable to carry like large items, right? Which is where the no
true.
comes to play. So we shouldn't just be looking at motorbikes. We should also be looking at buses, vans, air cargos, and possibly even drones in the future. Who knows,
Hmm.
right? So I would say that Nigeria depends heavily on multimodal integration in terms of logistics. So we shouldn't just base our representation of logistics based on motorbikes only, but on other transport systems as well. And also, logistics is not just the transportation, right? It also has to
Okay.
do with like the coordination, the warehousing, and route optimization.
Hmm. Okay, interesting stuff. Now, because of time, I'm going to ask you a two-in-one question, just so that
Okay.
we can get through this. Now, I mean, from your experience and your perspective as well, what
Yeah.
else can technology actually do to improve logistics in Nigeria? And do you think that the skills pipeline for tech in Nigeria right now is sufficient, in your
Yeah.
opinion?
Okay, so the first one, I would say technology can help in real-time tracking of these items. So in the UK, the moment your item is being shipped from the manufacturer, you can see how it moves down to your doorstep, right? And they also have the mobile platforms where you are able to see, okay, has this product been delivered, right? You have a proof of if the product has been delivered, right? So I would say that in terms of that particular question, technology can help in terms of real-time tracking. It can help in
Okay.
terms of AI-powered routes as well as digital inventory management. So in terms of if the skill pipeline for tech in Nigeria if it's sufficient enough, I would say that Nigeria has a growing population. Like our population is young and is growing, and everyone now knows that tech is like the new oil, right?
Hmm.
So I would say that we are now having lots of boot camp where people can take online courses and all of that. But we also have like the gap because when you do these trainings, right? When you do the training and you're accessing a real-time data, it's different, it's a different ball game. So I would say why people
Right.
take these trainings, they should also take on a mentorship. We have mentorship platforms such as Pushfar, such as ADP List. So to round this all up, I would say Nigeria not only need coders, we also need product managers, we also need UX designers, we also need digital savvy domain experts as well.
All right. Thank you for putting that out there. Maybe I just could consider getting into that field. I mean, since we need all those experts, maybe, just maybe,
I think
I
you
might jump
should.
in, I might jump in that direction. All righty.
Yeah.
Thank you so much for
Yeah.
sharing this with us this morning. I've been talking with Benedicta Etafo. She has been using her knowledge as a data analyst to spread the good word as to how technology can improve Nigeria's healthcare and logistics as well. Thank you so much, Benedicta, for joining me this morning.
Yeah. Thank you so much for having me.
All right, absolute pleasure. Have yourself a great Friday and a
You
great
too.
weekend in prospect.
Bye.
All right, then. And thank you for being a part of Business Express this morning, brought to you by InterSwitch. Keep it tuned to the smooth breakfast. Things are heating up. Great music coming your way to Feel Good Friday. And of course, 7:30 will be time to get into the papers on Freshly Pressed.